Linda Joy Lee describes an assessment technique called the prone arm lift. It is similar to the active straight leg raise that we perform for the sacroiliac joint. I am going to be asking Greg to lift his arm up. In our words, that means I'm going to ask him to forward flex his arm at the glenohumeral joint. I'm not asking for any rotation in the thorax or anything else. So I'm watching for him to lift his left arm up and put it down and compare that. How does this one feel? And put it down. So watching for excessive amount of bracing through the thoracic region. If there was an area that it reproduced pain, or if one arm was more difficult to lift up, you can apply compression to that thoracic ring and then ask him to lift the arm again and see if it makes it any easier. We are in near end range shoulder flexion, even though I've lowered the headpiece down. So anyone with a bit of shoulder hypomobility, you are going to get an asymmetry in your findings. But if their shoulder joints are good and they have difficulty lifting up that arm compared to the opposite side, it's heavier, and then when you apply the compression, all of a sudden they're able to do it. This is suggestive that the thoracic spine is not stabilizing itself properly before the lift of the arm, and you would then give them thoracic stabilization exercises. That's it.